Hello, everyone, and welcome to our team's multimedia presentation, which is part of our final project in the ISDA 110 Tech Culture course with Professor Matthew. Please join us as we dive into this innovative and engaging experience of extended reality and its application within the healthcare system. Our goal is to share our research and discoveries about the various aspects of this cutting edge technology and its impact on the medical industry. But first, allow me to introduce the team. My name is George Triplet, and my fellow presenters joining me are Gordon Tao and Kevin Villa. We are all students in the Information Science and Data Analytics program at San Jose State University. And with that, I'll begin outlining the fundamental concepts of extended reality. So, what is the meaning of extended reality? Well, extended reality, which is also known as XR, is an umbrella term for the three immersive technologies that merge physical and virtual worlds, and they are virtual reality, or VR, augmented reality, or AR, and mixed reality, also known as MR. Virtual reality is considered as a fully immersive experience where the user is transported into a simulation of a three-dimensional environment. VR is also the most mainstream of the three due to its exposure in gaming and movie industries. Augmented reality creates an interactive experience by overlapping digital elements onto the real world. Popular examples include Google Lens and Amazon View. Last but not least, mixed reality. MR is the blend of real world and digital elements, allowing users to interact with both virtual and physical objects. Think of this as a combination of virtual and augmented realities. Although this presentation focuses on health and wellness, these innovations extend to a multitude of industries such as education, retail, and entertainment. In essence, extended reality allows users to interact with digital content unlike any other. Integrating extended reality with the healthcare industry is one of the most promising digital health innovations in development. It can completely revolutionize healthcare and medicine for physicians and patients alike. With implementation of hardware devices and software applications, extended reality can enhance medical care, training, diagnostics, treatment, and patient outcomes. By creating immersive digital environments, these technologies have the potential to transform traditional healthcare deliverables through interactive and data enriched environments, allowing for medical professionals to streamline the consolidation of real time patient data, medical scans, and AI model personalization. Furthermore, improvements in assessment accuracy and avoidance of invasive procedures are just a few of the upsides of this evolving innovations. Now that we've explored the different facets and general concept of extended reality as it relates to healthcare, I give the floor to Gordon Tao, who will discuss in greater detail the potential possibilities of this remarkable advancement in technology.
I would like to thank George for introducing what extended reality or XR is. I'm going to talk about some big possibility that XR brings to healthcare. The first one is revolutionizing medical training. XR lets doctors and medical students practice surgeries and medical skills in a safe virtual space. This way, they can learn and make mistakes without risking real life. This helps them get better and more confidence before they work on real patients. Another big benefit is improving patients' rehabilitations. XR helps patients recover from strokes or injuries by giving them fun and interactive exercise using VR. This makes therapy less boring and it keeps patients motivated to get better. XR is also expanding healthcare possibility globally. It helps doctors from different places work together even if they're like far apart. For example, doctors in one country can help doctors in another country by looking at the same 3D models of the patients at the same time. This happens through something called collaboration through mixed reality. It lets medical teams share live patient data and 3D visuals. while they're working together, which helps them make better choice for patients. But all these great tools, it's still important to think about ethical and fair uses. Not every hospital can afford these technologies, so we should work to make XR available to everyone, not just the biggest hospital. XR gets better when we combine it with something called big data. Let me explain how they work together to improve healthcare even more. Big data refers to patients' information collected from medical records and tests. XR takes these data and turns it into interactive 3D experiences that are easier for doctors to understand and use. For example, doctors can view 3D models of a patient's bodies while seeing their medical history, lab results, and real-time health data all in one place. This helps them make faster and more accurate decisions when treating patients. XR also makes it possible to show information during surgery. With mixed reality headsets, doctors can see live patients right in front of them without having to stop and check the screen. This keeps their attention on the patients while giving them the data they need to work safely and effectively. Another benefit is personalized care. As XR tools collects data on how patients respond to treatments, the technology can adjust and improve the experience based on the patient's unique needs. This could lead to better, more customized cares over time. However, we can't ignore the privacy risk. With all the data being used in a virtual environment, there's a real concern that keeps the patient's information secure. Healthcare provider needs to have a strong data protection policies that make sure that personal health data stay safe and private. In the end, the connection between XR and big data has the powers to make healthcare smarter, safer, and more personal, but only if they use it responsibly. Up next, I'll hand it to Kevin, and he will talk about the challenges about XRs and healthcare.
All right, thank you, Gordon, and thank you, George, for introducing us to this topic. Hi, everybody. My name is Kevin Villa, and I will be expanding our presentation today by discussing some of the challenges that come with extended reality in healthcare. Now, the first challenge that I'd like to talk about is the high cost. These devices, for example, a surgical training simulator, can range anywhere starting from $30,000 to well above $100,000 per device. Now, these devices aren't standalone. There are licenses needed that also need to be purchased, which can cost, again, well in the thousands of dollars. On top of that, current infrastructures may need to be upgraded to accommodate for these tools. These high prices may make these devices just straight up inaccessible for smaller facilities, and at the end of the day, to the patients themselves. The second challenge I'd like to talk about is the technical limitations. These devices may have low resolution when compared to real life. An example of this is Amazon's View in Your Room feature, which always makes reality look a bit cartoonish. These devices also may have a limited field of view since they're typically worn on your head, or they rely on a camera and a screen which only capture a preset field compared to your natural eyesight. Lastly, they provide little to no tactical feedback since these are digital reproductions, so it may be difficult to correlate what you're seeing with real life. The third challenge comes with data and privacy concerns. Patient data in virtual environments raises concerns about privacy and data breaches. Now, with these devices in place, there needs to be strict compliance with privacy laws so that we can protect patient information. Now, those aren't the only issues. Other challenges may be physical side effects. Some people using these devices may experience nausea, dizziness, eye strain, or headaches while using them. User acceptance and training. Professionals may resist to adopt these because there is a steep learning curve to them. Also, extensive training programs would be required to make sure that everybody is properly trained on how to use them. Lastly, if we get past all the other hurdles that we've talked about, the last thing that we've got to get through is limited clinical validation. These tools and technologies are still largely in experimental phases, so there's a large need to do a lot more trials to prove that they are safe and efficient to use in healthcare. We appreciate you taking the time to be here with us today. Again, my name is Kevin Villa. I'd like to give a shout out to my partners George and Gordon for all their work and effort. Today, we gave you a brief overview on extended realities, which include virtual, augmented, and mixed. We also went over the possibilities, big data, and challenges that come with them. Now, it is possible we may start seeing more of these tools and technologies used in healthcare, but we have a long way to go before they are fully embraced and implemented. I highly encourage you to look into these technologies as we move into a world that is more and more integrated with AI. It is undoubtedly an exciting time for healthcare since it's at an intersection with technology. Whether you're a skeptic or enthusiastic about it, we encourage you to stay curious and positive about the possibilities. Thank you again. We're Team Goose, and it's been a pleasure presenting to you.